Imagine feeling trapped in a cycle where you rely on a small pill or a teaspoon of syrup just to feel normal. Maybe it started with a pain that wouldn't go away, or a cough that lingered, or maybe just a restless night where sleep seemed impossible. Now, you feel like you need codeine just to get through the day. You're not alone, and you're certainly not at fault. Codeine is a powerful drug that, when used for extended periods, can hijack your body and mind, turning your reliance into a struggle. Let's talk about why this happens, what you can do about it, and, most importantly, how you can get back to feeling like yourself. Section 1. What is codeine and why is it prescribed? Codeine is an opioid medication commonly used to treat mild to moderate pain, coughing, and even insomnia in some cases. In small doses and under strict medical supervision, codeine can be a very effective way to manage these symptoms. The problem: codeine is in the same family as morphine and heroin. Even though it's a milder opioid, it can cause dependence if used regularly. Your body starts depending on codeine as part of its routine, something that quickly moves from short-term relief to long-term reliance. But the path from I need this for pain to I need this just to feel normal can be quick, and it's easy to miss the warning signs until codeine's grip feels like it's become unbreakable. Section 2. What is codeine dependence, and how is it different from addiction? Let's clarify something important. Dependence and addiction are two different beasts. Dependence is physical. It's what happens when your body adapts to codeine and essentially says, I need this to function. So, when you stop, you feel a range of symptoms, both mental and physical. This is called withdrawal. Addiction, however, is more about behavior and compulsion. It's when someone continues to take codeine, despite knowing the harm it's causing. They may crave it, think about it constantly, and have a hard time stopping, even when they want to. While dependence might just involve a physical adjustment period, addiction can take over someone's mind and their life. Section 3. The reality of codeine withdrawal. So, what happens when you stop taking codeine? Withdrawal is the body's way of reacting to the sudden absence of a substance it's gotten used to. Think of it as a protest. The body has grown accustomed to codeine's effects, and now, without it, things start to feel uncomfortable, even painful. Common symptoms include sweating, irritability and mood swings, stomach cramps, muscle aches, nausea, insomnia. It's like a bad case of the flu, but it can also make you feel anxious, frustrated, and unable to focus. For some, these symptoms might pass in a few days. For others, it can last weeks or even months. Section 4. What causes codeine withdrawal symptoms? Codeine binds to opioid receptors in your brain, slowing down pain signals and creating a relaxed, sometimes euphoric feeling. With time, your brain adjusts, demanding more codeine to get the same effects. So, when you stop taking it, your brain isn't getting what it's grown to expect, and it reacts. Factors that increase the risk of codeine withdrawal include high dosages, long-term use of other substances, like alcohol or anti-anxiety medications. Pregnancy and certain medical conditions can also make withdrawal more challenging. In some cases, quitting codeine without medical help isn't safe, particularly for people who might face complications during withdrawal. Section 5. Treating codeine withdrawal. What are the options? Not everyone needs treatment to get through codeine withdrawal. However, for severe symptoms, there are a few medication options that can help ease the process. 1. Buprenorphine. This medication works similarly to codeine but is weaker, helping to manage symptoms without feeding into dependence. 2. Methadone. Often used in severe cases, methadone works on the same brain receptors as codeine but can be addictive itself, so it must be used carefully and under supervision. For specific symptoms, like muscle pain, doctors might prescribe non-addictive pain relievers or nausea medication. In cases where withdrawal symptoms are intense, supervised care may be necessary. Section 6. Long-term treatment for codeine dependence and addiction. If codeine use has evolved from dependence into addiction, long-term treatment becomes crucial. Addressing addiction means going beyond physical symptoms to tackle the underlying reasons that led to substance use in the first place. Treatment options include therapy. Counseling can help people understand why they became dependent on codeine and develop healthier ways to cope. Support groups. Programs like Narcotics Anonymous can be a huge source of strength. Lifestyle changes. Replacing codeine use with hobbies or wellness practices can boost well-being and reduce cravings. Treating underlying conditions. For those with chronic pain, alternative treatments like physical therapy can offer relief without the need for opioids. Section 7. Who should seek help for codeine dependence? If you find yourself needing codeine in higher doses than prescribed, using it for longer than recommended, or taking it without a prescription, it might be time to seek help. And if you're pregnant, have another substance dependence, or any co-occurring health issues, you should avoid trying to quit codeine on your own. These factors can complicate withdrawal, making it both more difficult and potentially dangerous to quit without medical assistance. Section 8. Codeine withdrawal is manageable, and help is available. The process of codeine withdrawal is challenging, and it can feel overwhelming at times. But it's important to remember, you don't have to go through it alone. By speaking with a healthcare professional, you can find the right tools to help you quit safely and begin to reclaim your life. Breaking free from codeine isn't just about getting past the withdrawal symptoms. It's about regaining control, rediscovering your own strength, and stepping forward into a future that isn't weighed down by dependence on a substance. The sooner you reach out, the sooner you can begin the journey, and take the first step toward a brighter, healthier future.